Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube, and the audio is available on Wisconsin Eye. Before opening remarks and your questions, a reminder to maintain quality audio, to please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Governor Tony Evers, Secretary-Designee and Chief Executive Officer of the Wisconsin Economic Development Corporation, Missy Hughes, DHS Secretary-Designee Andrea Palm, and available to answer your questions are Dr. Ryan Westergaard, a Chief Medical Officer with the DHS Bureau of Communicable Disease, and Ryan Nilsestoon, the Chief Legal Counsel for the Governor's Office. We begin the briefing with remarks from Governor Tony Evers.
Good afternoon and welcome back after the weekend. As you know, last week I extended our Safer at Home order. This is not an easy decision to make, but as I've said all along, the health and safety of the people of our state comes first. But at the same time, we also know that we have to do everything we can to reopen our state as soon as we can safely and responsibly while recognizing that we will not get back to normal until we have a vaccine. No one wants to reopen our economy as much as I do, but folks, like I've said before, it has to be more like turning a dial than flipping a light switch. And that's why Safer at Home is so important, so that we can continue to make sure our healthcare workers and system aren't overwhelmed while we're taking important steps to be able to turn down that dial safely and sooner. We have heard from workers and businesses across the state about how eager they are to get back to work. We are eager too. This is going to take careful preparation and planning, and that's why today we're announcing our Badger Bounceback plan to ensure our state can bounce back from COVID-19. As we've learned over the past month in the most difficult of circumstances, we will rise to the occasion, helping each other and working together to do what's best for our families, our neighbors, and our communities. Now, I'm jazzed and hopeful about this plan. While being safe at home continues to be very important, this plan is an all-out war on the virus, and it begins the process of preparing our businesses and the workforce to begin the important planning that will result in a safe and logical phase-in of our economy. And that's what the Badger Bounce Back is all about, our resilience as a people and as a state. So today we announced an order outlining the phases for our Badger Bounce Back plan, which outlines important metrics for us to be able to reopen our economy in phases and includes steps to make sure our workers and our businesses are prepared to reopen as soon as it is safe to do so. In order to move beyond the Safer at Home phase, we need to meet some important criteria. The metrics we're using are based in large part on the President's guidelines for opening up America again that was issued by the White House on April 16, 2020. Right now, Wisconsin does not meet the criteria the White House established to start reopening our state. But with our Badger Bounce Back plan, we're going to be taking some important steps to get us there. First, we need to see a 14-day decline of COVID-19 symptoms reported. Second, we need to see a 14-day decline of positive tests as a percent of total tests. And third, we need to make sure our hospitals can treat all patients and have a robust testing programs in place for at-risk healthcare workers. And finally, as I mentioned last week, we need to increase lab capacity and testing, increase contact tracing, including support for isolation and quarantines, so we can track the spread of COVID-19, increase our healthcare capacity, and procure more personal protective equipment. So as part of our Badger Bounce Back plan, we're expanding testing criteria and increasing lab capacity. Everyone who needs a test should get a test, and we're setting a goal of 85,000 tests per week, about 12,000 tests per day. Wisconsin started its COVID-19 testing efforts with a small group of dedicated labs, including the State Laboratory of Hygiene, the Milwaukee Public Health Lab, UW Health, Gunderson Lutheran, ACL Laboratories, Mayo Clinic, and Wisconsin Diagnostics Lab. This group helped us build a critical base to grow from, and we owe a special thanks to each of them for getting in on the ground floor. But as we've learned over the past month, there's a lot we can accomplish when we all work together. It's going to be a whole team effort to boost our testing efforts in Wisconsin. Exact Sciences, is devoting a significant portion of its lab capacity and resources to COVID-19 test processing. This will enable them to provide the state with approximately 20,000 tests and processing each week, which we will be distributing to healthcare systems throughout the state. This was a major effort by Exact Sciences, undertaken in a very, very short amount of time. Epic is providing crucial assistance in our effort to distribute Exact Sciences tests by providing the interoperability necessary to connect healthcare providers with Exact to ensure timely processing of tests and reporting of test results. Promega is providing major support by sourcing high-demand reagents and materials for a number of labs in the state, including Exact Sciences labs. In addition to these materials, they've also shared equipment and provided invaluable problem-solving skills. They are a critical part of our supply chain in supporting expanded testing. This week, Marshfield Clinic Health Systems will be working on ramping up to process 10,000 tests per week from providers around the state. And through additional procurement efforts by the state, we will be receiving over 250,000 additional test collection supplies in the coming weeks. I want to thank all these folks for their good work in helping us make sure we can increase our testing levels through our Badger Bounceback program. Additionally, I'm excited to announce that we are deploying National Guard teams to locations across the state to set up testing sites in places where COVID-19 outbreaks and places with community spread. These National Guard teams will set up and administer testing in communities where they are needed most. In fact, their work has already begun with one team at the Milwaukee County House of Correction this weekend. And in addition to increasing our testing capacity, we also need to bolster our contact tracing efforts. So our Badger Bounceback plan also includes an effort to add 1,000 contact tracers to our efforts. Now I need to circle back to my previous comments. In addition to being safer at home, these are historic people power commitments in our 24/7 war against the virus. All of these efforts are critically important to ensuring that we can reopen our economy as soon as we can safely and responsibly can, and to make sure our workers and our businesses are preparing to be open as soon as it is safe. To lead the charge with our business community, WEDC Secretary Designee Missy Hughes is going to be working with small, medium, and large-sized businesses to help us figure out how to minimize disease transmission in the workplace, identify worker safety protocols, and help ensure customer safety as we move forward as a state to bounce back. I know that these continue to be difficult times, but as always, I know as Wisconsinites, we will rise to the challenge just as we have over the past few months. I want to thank all of you for all the work you're doing to keep our families, our neighbors, and our communities safe by staying safer at home so that our state can bounce back as it always has. And with that, I'll turn things over to WEDC Secretary Designee Missy Hughes.
Thank you, Governor. Today, with the launch of the Badger Bounceback Plan, we bring together two efforts that have been going on since we started fighting this challenge in Wisconsin: combating the virus and rebounding the economy. So our job at WEDC is to support the Badger Bounceback Plan by working with the businesses to continue to weather this storm, and now to prepare for the process of reopening the economy. Because as the governor pointed out, we have universally agreed this is not about flipping a switch, but turning a dial. The Badger Bounceback Plan charges businesses with the task of preparing for the new challenges ahead. The challenge of serving customers safely, of making sure our workforce is secure and protected, and being part of the communities that move ahead. So when we can be confident that we have kept our employees, our neighbors, our friends, and our family safe, companies and entrepreneurs, innovators, farmers, chefs, waitresses, barbers, and shopkeepers will all be ready to come back to work, and our economy will truly restart. So we need to get ready. This is really nitty-gritty hard work that we need to do right now in order to be ready for when the criteria that the governor laid out are in line with the opening of the economy. This is hard work of looking at our workspaces and understanding how do we need to change those workspaces? How do we need to change our workflows? How do we make sure that our employees are staying socially distanced away from each other and interacting with the public and their customers properly to make sure that we're doing all the protocols in place that will help us maintain our safer at home wins, and then also to prevent the further spread of the virus. So we're working alongside and in collaboration with the Badger Bounceback Plan, and we've started what's called Wisconsin Ready. And this is a strategy to help businesses of all sizes and types throughout the state to resume operations. So we have 3 pillars for Wisconsin Ready. The first is roll up our sleeves, and then invest in our future and get the word out. So first, rolling up our sleeves. We need to ensure, as I said, that our employees and our customers are safe. In many cases, this will require new ways of doing business to ensure people's safety. And given the diversity of the size and scope and nature of Wisconsin's business, a one-size-fits-all approach is not going to work. So we're going to have a multifaceted effort in collaboration with our state's business leaders to bring together all the right guidelines and protocols for each individual types of businesses that will promote social distancing and other practices, as well as HR policies to protect worker health and customer safety. So these protocols and guidelines will help businesses know how to approach their workspace, how to make choices within their different places and their facilities to make sure that they're thinking about, how do we make this work for our new normal? Whether you're a manufacturer, a construction company, a restaurant, or a retail store, you're going to have all sorts of different challenges to face as you're thinking about reopening your business, and we want to be there to assist with that. So the governor, as he mentioned, is asking me to bring together the best minds in the state. We have incredibly strong businesses, as the governor pointed out, with Exact Sciences and Epic and ProMega. We're going to bring these minds together to help us think about how to reopen and how to prepare our businesses for the challenges that they face and how to have the right tools. And throughout this time, throughout the challenge we've been facing, I've already been working closely with businesses all across the state and our chambers of commerce and our economic development organizations. We have an amazing network of expertise and knowledge that we're going to bring to bear on this challenge and do this together. This is particularly in Wisconsin's wheelhouse to be able to face this and overcome it. We also need to talk about the resources to restart and invest in our future. At WDC, we've been working incredibly hard to understand the economic impacts of this virus and what businesses have been affected and what help they need and what kind of resources we can get them to help restart their operations. We're currently partnering with UW-Oshkosh and our 11 regional economic development organizations to conduct a statewide survey to understand the impact and the practical things that our small businesses are facing. We're also looking at real-time merchant transaction data to understand how different business sectors are being impacted. And when we start to restart, we can watch that data and understand where we need to lean in and provide help and how those things are developing. So, while these impacts have been incredibly devastating, we have continued to assist businesses in accessing federal funds and making sure that we're working with our community banks and our credit unions to help them as the federal funds come into our state. And to date, we've had over 43,000 businesses in Wisconsin able to access about $8.3 billion worth of small business funds. So that's an average of about $190,000 per business. And that's really punching above our weight class, as they say. We're doing well, and that is really a credit to those community banks and those credit unions that are helping our small business access those funds. And as we see additional funds come through, hopefully in the next few days from Washington, we will again be helping small businesses to access that. And I encourage businesses to go to sba.gov or to our website, wedc.org, to make sure that we've got a good pipeline of applications going into the Small Business Administration. At WEDC, we've also been looking for the gaps in that financing and where can we help the businesses that aren't able to access the small business loans. We've provided grants to many small businesses through our SB 2020 program, and we're very encouraged that we've been able to reach those micro businesses, those businesses with less than 20 employees, and provide them some support. But this is really just a drop in the bucket. And we need to continue to think creatively about how we can assist businesses and what they're going to need really to grease that engine to get the economy started again. One of the programs that we're developing and thinking about and going to be proposing is called Restart 72. And this is an effort to bring together resources for a grant program that will help businesses with things like working capital and buying inventory. And perhaps, if they need to buy PPE or plexiglass shields for their businesses, making sure that they have the grant dollars to be able to do that. So we look forward to continuing to work with the governor and the legislature on those pieces. And finally, a really critical key part of this effort is our complete commitment and agreement amongst businesses and employees and consumers and customers and all Wisconsin citizens that we all have to do our part. We all have to be a part of social distancing and respecting each other's protocols that we're putting in place, because we're going to do all this hard work to set up our businesses and be ready to receive customers. And so we all need to be part of that effort and practicing what we preach, as they say, so that we can all get the economy rolling again, which is really what we all want. Wisconsin's economy has always been based on innovation and overcoming adversity. We're problem solvers, we're bootstrappers, we can overcome this challenge. We are incredibly hard workers, and while this is going to take some hard work to overcome, we are completely ready to take this on. So by teaming up with the Badger Bounceback Plan, we're ready to take up this challenge, and we're ready to be Wisconsin ready.
And now DHS Secretary Designee Andrea Palm.
Thanks, Missy. Thanks, Governor. Good afternoon, everyone, and thank you for joining us again today. With our partners around the state, we at DHS are committed to doing the work we need to turn the dial and open our state as soon as possible. And we are committed to opening up the state without opening ourselves up to a resurgence of the virus. That is how we can protect the well-being of our people and our economy in the most effective way. To do this, the governor has announced the Badger Bounceback Plan today, and I signed Emergency Order Number 31. The work of federal, state, and local leaders has informed Badger Bounceback, helping guide our thinking about when to turn the dial by providing clear criteria to meet as we make progress towards our end goal of a healthy and open Wisconsin. Turning the dial will mean reopening in phases. Our first turn of the dial, Phase 1, will make it possible for restaurants to open while implementing physical distancing, for people to gather in groups of up to 10, and for children to return to childcare. Phase 2 will turn the dial further with gatherings up to 50 and the opening of bars with physical distancing. Our ultimate goal is to continue to work together with all of you to reopen as widely as possible as soon as is safely possible. We've been committed to transparency during this epidemic from the very beginning. We want you to know everything you need to in order to understand our process and to see how we can all work together to make it possible to open our state up in these phases. To that end, you need to know that we are dramatically increasing testing, as the governor talked about, and that we are striving to ensure that everyone who needs a test will be able to get a test. You need to know that everyone who tests positive will be contacted as part of our expanded contact tracing system. And you need to know that we are increasing the capacity of our healthcare system, including our long-term care facilities. Our healthcare system will need to both be prepared in case of a resurgence and be able to resume providing for the health needs of other patients. We need to get back to a place where we're no longer deferring the needed healthcare of the people of this state. This is critical to the overall health and well-being of our people and our state. And you need to know how critical PPE is to these steps. We continue to try to procure these items through existing supply chains, including our federal partners at FEMA. We are also partnering with Wisconsin manufacturers to help them increase their output or even to retool their factories to make these supplies for the first time. None of these exist in a vacuum. By themselves, not a single one of these actions is enough. Testing sites need labs, lab results need contact tracers need isolation facilities for patients, patients may need hospitals, hospitals need staff, and staff need PPE. Badger Bounceback is an interconnected plan, and progress on just one aspect will not mean success. That is why partnership is so important. An example of that partnership is our work with Exact Sciences and the community health centers in Milwaukee to support additional testing capacity. Community health centers will first work with their patients and then expand through a network of social service organizations to further help their communities. If you're experiencing symptoms of COVID-19, please call your healthcare provider to access a test. We cannot save lives and turn the dial without our partners across the state. These partners include our labs, businesses, local health departments, the National Guard, our frontline healthcare workers, and first responders, and it includes each of you. We know this isn't easy, but it is incredibly important. It is saving lives and reopening safely as soon as we can by meeting the criteria of our Badger Bounceback plan and starting our phases to turn the dial. That will also save lives by preventing a resurgence of the virus. We have to do this together, and together we will do all we can to make that timeline as short as possible. And as usual, I'd like to give you an update on where we stand today. We have 36 active labs running COVID-19 tests in Wisconsin with a daily lab capacity of 7,238 tests. We have 46,603 negative tests, which is an increase of 1,280 over yesterday. We have no new counties reporting cases for the first time, and there are now 4,499 confirmed cases of COVID-19, an increase of 153 cases here in Wisconsin. Our number of COVID-19 hospitalizations is 1,211, which is an increase of 21. And this means that 27% of the people who have tested positive for COVID-19 in Wisconsin have been hospitalized. Our total deaths have now reached 230. That's an increase of 10, and Clark County is reporting their first death from COVID-19 today. It certainly remains difficult to see our daily numbers climb, and that is why our continued work and continued partnership are so important. Thank you for all you are doing and will continue to do to protect your health and well-being and that of your fellow Wisconsin residents.
We'll now open it up for questions. A reminder to maintain audio quality, to keep your phones on mute until it's time to ask your question. And in the interest of time, please one question per reporter. We'll begin this afternoon with Casey Nelson from WTAQ Radio in Green Bay. Casey?
Hi, thanks for taking my call. My question is, the Tavern League is pushing for a May 1st opening of bars and restaurants across the state. Can you kind of comment on that and how you'll be handling that kind of discussion?
Well, certainly we are aware of different people requesting different things, and it'll be discussed, but at the end of the day, May 1st, I feel relatively confident that would be a tough row to hoe. We are following the White House's guidance, and there is a phase in which bars and restaurants are specifically identified, and we aren't even to phase 1 or phase 2. So we look forward to that day of making that happen, and we have made a commitment to our people, the people of our state, and also, frankly, to our nation, that we would follow the CDC White House guidelines.
Thank you, Casey. Now to Scott Bauer from the Associated Press. Scott?
Hi, thanks for the call. Governor or Secretary Palm, can you detail specifically where the state plan differs from the federal guidelines? And do either of you have any kind of estimate as to when you think we may get to phase 1, phase 2, and phase 3?
Well, I think we're pretty consistent with the plan. I can't think of any place we aren't right off the top of my head. It can't be extraordinarily a big issue. So I can't think of any off the top of my head. Maybe Andrea does know. But the plan's quite simple. You know, we reach these goals, these metrics that frankly are important for us as a nation and as a state. And if we meet those goals, then we will proceed into phase 1 and phase 2. There's no timeline. Clearly, if we could do it tomorrow, we'd do it tomorrow, but obviously that isn't the case. And we are providing extraordinarily large person power effort here that is going to be extraordinary. It's going to be a 24/7 war on this virus, and we're going to take it on and eventually get to a point where we can reopen the economy. There is no, the virus has never given us a timeline, but what we do know, if we do the things that we planned or that we are embarking on here, that we will get there sooner.
Thank you, Scott. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah, thank you very much for the call today. So it's been about 2 weeks since the spring election. I was just curious if there have been any public health investigations into COVID-19 cases since April 7th, if that's revealed the election as a source for transmission.
So Mitchell, it's Andrea. I think folks do need to remember sort of the progression of this virus, right? From infection to symptoms to the conversation with your physician to the test result. It's not surprising that we have not seen information in the data that suggests that we've seen a large uptick from in-person voting on the 7th, but we continue with all of our work around the state to be focused on places where there might be outbreaks, to understand what the root of those might be, to surge testing capacity if need be, like we're doing, or we did over this weekend with the National Guard team to the House of Corrections, like we're doing in a few other places around the state right now. And so we will continue to look at our data to make sure that we are strategically responding to outbreaks as they happen.
Thank you, Mitchell. Now to Jeremy Janine from Urban Milwaukee. Jeremy?
Question. In the Bounceback plan, it talks about an adequate supply of PPE. Looking at the Wisconsin Health Association dashboard, Hospital Association dashboard, it's unclear what adequate might mean. It outlays a 7-day supply.
Well, certainly we aren't satisfied with the amount of PPE that we do have. The Hospital Association, others, I just talking with a group of first responders today that are also concerned about this. So we know what adequate isn't, and that's where it is right now. We believe we can get to that point where we feel confident that the equipment going forward is adequate. Now, I don't have any recent numbers on I don't know if you do, Andrea.
So I would just add, I think one of the important additional things that we are focused on, recognizing that there are supply chain issues, that we are competing with states all across this country, is that we are also looking at decontamination technologies and the options that we might have to provide that service to facilities around this state so that we can be partners in decontaminating for reuse protective equipment so that we are able to continue to push or maintain a larger supply among our healthcare workers. So we are pressing on every lever that we have to increase our access to PPE across the state and for our healthcare workers. I think another important part of this, to the governor's point about there not being enough, is I think, right, we've talked about the need to return to a place where care that has been deferred can start to happen again. And one of the rate limiting factors in that equation for hospitals all around this state is access to PPE. It's also access to testing, certainly, but adequate PPE continues to be a rate limiting factor in a number of ways for our frontline healthcare workers. And so we will continue to prioritize getting more PPE in the state of Wisconsin, and that will just continue to be a major piece of our work moving forward.
Thank you, Jeremy. Now to Ben Meyer from WXPR Radio in Rhinelander. Ben?
Good afternoon. Question for you. Is it possible that we could meet the metrics needed to get to phase one before May 26th?
Well, there's always, again, as I said before, the virus controls a lot of this conversation, but I believe that if we do 24/7, bring all the pieces in place, the testing, the contact tracing, the PPE, that we have a shot of doing that. But we don't know for sure, obviously, or I would tell you that. So we're going to work, it's a 24/7 thing. I am very, very hopeful that we will get there. And that's our commitment, to work 24/7 for the next weeks to make sure that we're at that place. That is critical for our state, and that's our commitment.
Thank you, Ben. Now to Magali from Spectrum News 1. Magali? Spectrum News 1? And a reminder to press *6 to unmute your phones. Spectrum News 1. Okay, we're going to move on then to Mason Dowling from WAOW-TV in Wausau. Mason?
Yes, hi. This question is for Governor Evers. So obviously this weekend we had several protests throughout the state, including here in central Wisconsin, about, people are asking you to open the state as soon as you can. Obviously this plan is part of it, but do you have any response specifically to those protesters and some of the things that have been said?
Yeah, actually, one of the things that going back to the last question I answered, we also need people to stay at home, and we can work 24/7 on this and still not accomplish people staying safer at home is a critical component here. So because I didn't talk about it, doesn't mean that I'm not concerned about it. Relative to what the protesters are doing, I respect and actually cherish the First Amendment, and I understand that people of goodwill will have disagreements, and this may be one place where we do disagree, but I respect their ability to the First Amendment, to use the First Amendment to express that, and I encourage them to stay physically distant from each other so that they can remain safe also.
Thank you, Mason. Now to Eric Gunn from Wisconsin Examiner. Eric? Eric Gunn from Wisconsin Examiner.
Thank you for taking this question. Where are we at this point on supplies to do the testing? And what have we gotten in terms of testing supplies from federal stockpiles or other sources? And can you tell us more about those efforts and how much we'll be able to use the capacity that the state has expanded to in terms of the materials needed to do that? Thank you.
I'll repeat some of the numbers I mentioned before because I don't have them right in front of me. I'm going to have to, or right in my head, I have to actually go through my notes. Through additional procurements efforts by the state, we'll be receiving over 250,000 additional test collection supplies in the coming weeks. Our efforts with Marshfield Clinic will bring another 10,000 tests per week from providers across the state. Our major effort with Exact Sciences and all the good people that are working with them will bring about 20,000 per week. And we continue to do every place we can to increase those testing supplies. I don't know if you have any more specific detail than that.
I guess I would clarify, Eric, that testing supplies were not something that were provided through the strategic national stockpile allocation that we got from the feds.
Thank you, Eric. Now to Mark Halverson from WWIB Radio in Chippewa Falls. Mark?
Yes, Governor Evers. Kurt Bauer, Wisconsin Manufacturers and Commerce, making the case across the state and upfront yesterday about asking for a more regional, sector-based approach. Even the CDC has seemingly allowed for this. Why not this? And so many of the cases seem to be in southeastern Wisconsin or northeastern.
Well, first of all, people have to, I'll start with something that we haven't said, and that is there may be times when we do look at a regional approach. Well, we have to take a look at that and do it safely. But also, we also understand, yes, there are places that have small numbers of cases that have been identified. That is not all of them, because most of COVID-19 are not symptomatic. And so to say that there's none in certain counties would just not be accurate. The second thing that comes into play here is that smaller counties that have smaller numbers, frankly, also have the smallest number of resources available to take care of a surge of any sort. And third of all, being of the same age as many people that retire up north, it's an older population and a population that is more susceptible to significant problems. So all those things come into play. I'm not saying that we may not look at things in a regional way for certain industries or certain businesses, but we need to do it. We need to have that collective work that's going on, and that's exactly why Missy Hughes is taking this on with WEDC, along with small businesses, medium-sized businesses, large businesses, all across the state of Wisconsin, including those areas that have small number of cases that are positive.
Thank you, Mark. Now to Emily Fannin from WKOW-TV in Madison. Emily?
Hi, thank you for taking this call. In this plan, you say every Wisconsin resident who has symptoms of COVID-19 can get a lab test. What is the tentative timeline on this, and when can people get it?
Emily, I can speak to that broadly, certainly. So we have been expanding our testing capacity over the last several weeks. Our goal of 85,000 a week will take us a little bit of time to get to, because it is beyond the announcements that the governor has made today. So we are ramping up. We will continue to ramp up to reach our goal, but under our current capacity, we are not using all of our testing capacity on a daily basis that we currently have. And so our goal in opening up the guidelines, in being clear in Badger Bounceback that everyone who needs a test should get a test, is part of the important work we feel like we need to do to make sure that providers all around this state understand the capacity, that patients who have symptoms understand the capacity, and that we are really starting to double down on our efforts to bring people the tests that they need, so we have a better understanding of the prevalence of COVID-19 in our communities across this state.
Thank you, Emily. Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly?
Thanks for the call. I was wondering if you could walk us through the gating criteria. Would there need to be a 14-day stretch of a downward trajectory of cases between each phase?
Altogether, I mean, it isn't looking at 14 days of the first criterion, and then we go to the second criterion and then third criterion. Those things will be measured simultaneously at the same time, and if we hit a home run, we'll get them all at the same time. In some areas, we're in a better position than others, but it isn't a sequence of things. It's all those we'll be measuring all those at the same time.
Thank you, Molly. Now to Adriana Bink from WFRV-TV in Green Bay. Adriana? WFRV-TV in Green Bay? Okay, we'll move on then to Will Cushman from WisContext. Will?
Hi there. My question is for Secretary Palm or anyone who can answer it. I'm curious if you could provide any more details about the outbreak in Brown County. As I understand it, the CDC is assisting with an investigation into that outbreak, and it seems to be growing quite rapidly.
We are well aware of that outbreak. We have been in close communication with the local public health department as well as the health systems in that area. We did deploy about 2,200 tests through our partnership with Exact Sciences to providers on the ground there to do a surge testing operation so that we could get a handle on positive cases, on their contacts, and we could help get our arms around the outbreak that we are seeing there. The CDC team, while we continue to surge additional contact tracing assets into the system, we certainly felt like we were not at a place where we had enough to help with this, and so we did engage with CDC to bring some assets here to that outbreak to help us do the work on the ground that needs to get done so that we are maxing out this testing surge that we've helped bring to that community so that we can do the tracing and isolation to help, again, stop the spread of this outbreak. But we are working very closely with our partners on the ground in Brown County. Do you have anything more you want to say about that, Ryan?
I think just that this is an outbreak in a community is a really, at this phase in our response is a good opportunity to develop the strategies that we want to use in the coming phases. So all of the things that we're talking about that we need to build capacity to do, testing on a larger scale and contact tracing are going to be, different in every outbreak that happens down the road, but we really wanted to invest in these early experiences so we learn lessons that we can apply, because the watchword going forward is going to be containment. We have to do all those things well if we're going to contain the spread, and we're going to have to put our efforts of containment where the outbreaks are happening. So this is a good opportunity to really invest a lot of resources and a lot of intention to try to do this as well as we can to protect the community right now, but also to make sure that we understand how to use these resources the best way for the coming months and year.
Thank you, Will. Now to Heather Poltrock from WSAW-TV in Wausau. Heather?
Hello, thank you. So one of the goals has been better contact tracing, and I'm just wondering what improvements need to be made to reach that goal.
So that really, as I'll use the governor's phrase, people power intensive piece of this Badger Bounceback plan, because in normal course of business, it is the nuts and bolts work of public health departments all across the state to do contact tracing. It's what we do in communicable disease outbreaks all the time. But the scale and scope of this pandemic is well beyond what we normally see. And so our ability to bring on board this targeted number of an additional 1,000 contact tracers is really fundamental to our ability to move those resources out across the state, whether it's focused on a particular outbreak, whether it's more broadly as we continue to do hand-to-hand combat, as Ryan said, as we move through the phases, as we just continue to have to manage this on a daily basis. But we set this target. We think that it is a reasonable goal for us, and what we will be doing over the next several weeks is developing and standing up a system whereby we are connected with our local public health, that we have the technology that we need to share information that comes out of those contact tracing interviews, and that we are building a system that allows us to isolate isolate and quarantine cases, and stop the spread of the virus.
Thank you, Heather. Now to Victor from CBS 58 in Milwaukee. Victor?
Thank you again for taking the phone call. Vice President Mike Pence said this weekend that there is sufficient capacity for testing across the country to move into the phase one of the plan laid out by the White House. However, some governors have disputed that, saying that in their states that's not the case. The first part of my question is, one, is there sufficient testing capacity in Wisconsin to move forward into phase one? And secondly, for the governor, what as this situation has progressed and moved on, we talked about how the federal communication and collaboration between the federal government and the states has worked. What's been your reaction with what the White House is saying and how they're responding, and that communication with you in the phone calls that you've had with the White House and beyond?
Well, my communication has been primarily through briefings from the vice president, and so that's usually been pretty well. It's usually very respectful and straightforward. However, the issue of testing, I would take issue that there are enough materials and the kits themselves that we need to go forward. Every state has this problem. So I feel confident that our work with the companies we already are working with and the organizations we're already working with, that we will get to that 85,000 per week. But it is going to take an effort on our part to find more partners, more materials, and make sure that we have the labs to do it. I think the lab piece is in pretty good shape. It's the materials going forward. It's critically important. All states are doing it. I know we can get there, but it's as I said before, this is 24/7.
Thank you, Victor. Now to Cami Rapson from WBAY TV in Green Bay. Cami?
Hi there. A question about in Brown County's case, where we're seeing a quote, significant risk potential. Do you envision widespread community testing in places where there is an outbreak? And what would be the criteria for you to say, yes, let's do that in this particular situation?
So as I mentioned, we have surged 2,200 exact science test kits to the ground in Brown County, and that testing is underway. So we have, in partnership with Brown County Public Health and the hospital systems in the community, undertaken an effort to do testing that is focused on the employees and families and community members that are linked to this particular outbreak. I think one of the things that is really crucial about the plan that the governor announced today around testing is this capacity that we have brought to bear through our partnership with the National Guard and these the testing, the mobile testing that is being stood up. 3 teams now. We will surge to have a total of 11 teams in the coming days, and it certainly is our goal to be able to utilize those where they are needed to help do the specimen collection, to do the actual testing where a hospital system or at the community level, the providers themselves don't have the capacity to do that. In this case with Brown County, our hospital partners were able to facilitate the staffing needed to do that, and so our role was to provide the tests and to help connect to some CDC resources to help with some of the contact tracing and specific workload beyond the actual specimen collection. But we will need to be nimble as we respond to outbreaks around this state, but our ability to provide tests when they are needed, to be able to use our mobile testing teams through the National Guard when that is needed, are the kind of assets that we feel like are really important as part of our plan and as part of the way we are going to be able to wrap our arms around outbreaks as they happen and prevent them from becoming bigger and jeopardizing local hospital systems from a surge that they aren't prepared to handle.
Thank you, Cami. Now to Sean Kirkby from Wisconsin Health News. Sean?
Thanks for taking my question. I had a follow-up on the contact tracing. Is that 1,000 new contact tracers as of today, or has the department made any progress towards that number? And would they be funded by the state and state employees, or is it a combination of state and local officials? Thank you.
So Sean, we certainly have, understanding the building blocks that we need to have in place to continue to protect the health and safety of the people of Wisconsin. We have been bringing on board additional contact tracing assets over the last several weeks. I think we are at about 150 folks that we've brought on board so far. So we will continue to build towards that goal of 1,000 and really need to work in partnership with local public health about what their own capacity is, how we might supplement that, how we work together to make sure the technology is in place to share the information that's necessary to make sure that our contact tracing is effective and connected to care and to the local public health system, et cetera. So we absolutely will continue to work in partnership with local public health moving forward. And will intend to hire or through contract with local public health agencies this necessary staffing resource.
Thank you, Sean. Now to Bruce Marcus from WRJO Radio in Eagle River. Bruce? And a reminder, *6 to unmute your phones. Bruce Marcus from WRJO. Okay, we'll move on then to Ryan Curry from NBC 26 in Green Bay. Ryan? Ryan Curry from NBC 26 in Green Bay. Okay, we'll move on then to Amy Reed from WISC in Madison. Amy?
Hi, Secretary Palm, my question's for you. Can you expand on the impact of the election? We're 2 weeks away from in-person voting. Should we be able to tell if there was an impact on the number of cases, and will expanded testing affect our ability to use data to measure an impact?
Again, I think folks need to remember the sort of lag time as it relates to the virus showing up. We have not yet seen indications of an impact from the election. We will continue to monitor that as well as other types of signals that suggest an outbreak so that we are deploying assets appropriately and efficiently to help communities around the state as they're seeing upticks or outbreaks or needed additional resources from us. And yes, to the second part of your question, it's the whole point of expanding our testing capacity. We want to have community-wide testing in a way that helps us understand the prevalence of the disease in communities across this state, and that will help us understand how well we are doing at containing it. And that is the critical link between understanding that prevalence and then turning it into the action we need to wrap around those positive cases and further prevent spread. So it is an absolutely fundamental and critical part of how we get to a place where we can actively manage this disease while we start to have more social interactions, start to go back to business, start to do the things we all want desperately to do. Our ability to trace and track and test are fundamental and interconnected pieces to allowing us all to return to some semblance of normal.
Thank you, Amy. Now to Evan Peterson from Fox 6 in Milwaukee. Evan?
Hi there. Thank you for taking my question. I'm curious, what's going to happen to the restaurants and their owners who violate the Safer at Home order and plan to open their doors in the next couple of days here? Thank you.
This is Ryan Elsistu, and I can answer that question. So any public health order is enforced by local officials, and there are penalties in terms of a fine up to $250. People can also be jailed. But I think the bottom line that we've seen, there's a few isolated stories of, one or two people here or there planning to violate the orders, but overwhelmingly we're seeing the majority of people in Wisconsin support Safer at Home. we're seeing the overwhelming majority of business owners and local law enforcement really working together to make sure that we're doing the right thing, we're boxing in the virus, and that we're able to make progress so that we can open up as a state as a whole. And it really is something where we're seeing folks, pull together so that that we're on the same page and can be able to make progress in terms of opening up entirely.
Thank you, Evan. Now to Jessica Van Egren from Up North News. Jessica? Jessica Van Egren. And a reminder, *6 to unmute your phone. Once more for Jessica Van Egren. Okay, we'll move on then to Miranda Suarez from Wisconsin Public Radio. Miranda?
Hi there. I want to ask a clarification question about the Badger Bounceback plan. When we're talking about the downward trajectories that you're looking at over a 14-day period, are you looking at trends or averages over a 14-day period, or 14 straight days of day-over-day declines?
14 straight days.
Thank you, Miranda. Now to Tajma Hall from NBC 15 in Madison. Tajma?
Hello, thank you for taking my question. So we're at about 4,500 positive cases as of today. Do we know, are these all currently people that have the virus? Do we know, does this include people who may have recovered since we started reporting these numbers?
Yeah, this is Ryan Westergaard. Thanks for that question. So this is the cumulative total of people who have tested positive. A large number of those will have recovered because the illness is generally self-limited. We don't generally do testing repeatedly for every person so we can document exactly when they're recovered. But a safe assumption is that if 30 days goes by after a positive test and people are out of that window where they're likely to be infectious. So we've posted some new nuanced description on our website to help people understand those data. But the most important message is that for a large majority of people, this is an acute self-limited infection that people recover. It can cause very severe illness, but most people get better within a couple weeks.
Thank you, Tajma. Now to WLUK TV in Green Bay. WLUK.
Hi, thank you. This is Mark Leland from Fox 11 in Green Bay. My question is, Shawano County Sheriff is joining other sheriffs across the state saying that they will not enforce the rules or laws that they say infringe on the constitutional rights of workers or businesses. He's asking to allow local officials to work with the local businesses to get back to work. I'm wondering, what are you saying to these sheriffs about this, and what concerns do you have that they're not going to enforce your own orders?
We have worked very hard with the sheriffs across the state of Wisconsin to provide as much protective equipment as possible. Clearly, we need to get them more. Our frontline workers are exceedingly important to this effort. So we feel confident that local law enforcement will enforce the law, but the idea that there's this mass group of people that need to be arrested and that's just not Wisconsin. Most people get it. They may not like it, but they're taking this order seriously. They see that it saves lives, and so the idea that whichever sheriff it is, I won't even comment because I don't remember what you said, but the bottom line is we're working very well with the sheriff's departments across the state to make sure that they have the equipment to do the jobs they need to do. And the people of Wisconsin are responding to Safer at Home. They're doing a great job. That's why we've saved lives. And so the ability for local law enforcement to do their job is more related to making sure they have the tools they need in order to keep themselves safe.
Thank you, Mark. Now to Stephanie Hoff from WIS Politics. Stephanie?
Hi, thank you. My question has been answered.
All right, thank you. Now to Robert Chappelle from Madison 365. Robert? Robert Chappelle?
Hi, good afternoon. Thank you. Hi, Governor. Last week you said that the Safer at Home order had saved 300 lives at least, maybe up to 1,400. I was wondering if anybody in the room can explain where that number came from.
I'll defer that to one of the experts.
Sure. Those projections are based on models that our data scientists at DHS and a number of other researchers and statisticians at other institutions have done. And the purpose of models is to really make an educated guess using early data on what the trajectory would look like without any intervention. So using the data from the first half of March, our modeling team projected what the expected, if the current trends continued through the beginning of March before the stay-at-home order, what would the total number of cases and the total number of deaths be a reasonably good guess. Again, there's a lot of assumptions, no model is perfect, but that was the general estimate with the numbers of cases. And so the numbers saved is what we've actually observed under Safer at Home, subtracted from those totals.
Thank you, Robert. Now let's go to Rachel from TMJ4 in Milwaukee. Rachel?
Hello. Are we seeing more daily cases reported because we're testing more people, or are there actually more people with the disease?
So our numbers over the past 2 weeks have really been relatively flat. You know, the number of new cases diagnosed have been between 150 to 190, some lower, some higher. If you plot them out by day, there's not a clear trend of going up or going down. So the message is that there's a continually new number of cases, which means people have been continuing to get infected over the past 2 weeks. And it's also important to understand that the people who test positive today may have been exposed to the virus up to a week or two ago. So I think the trend over the past several weeks tells the story that we've been relatively flat.
Yeah, just to add on to that, the metrics that we're using relative to the White House CDC approach that we're working to as a benchmark is the number of cases per the number of tests. So that will be taken into account as we look at our metrics and our success.
Thank you, Rachel. Now to Eric Litke from PolitiFact. Eric? And a reminder, *6 to unmute your phones. Eric Litke from PolitiFact. Then let's move on to Andy from WISN TV in Milwaukee. Andy?
Hi, this is Nick Ford from Channel 12 Milwaukee. My question, I think, is for the governor and Andrea Palm about the protest we saw in Brookfield over the weekend. Do you think police should handle that any differently? They obviously just allowed it to continue. There's more protests planned this week. And are you concerned about anything being spread that way?
Well, certainly anytime people get outside of the physical distance that everybody is recommending, then that puts people at risk. So people are exercising their right to the First Amendment, and I think that's an important right. And but we're very, very hopeful that going forward, that they respect the physical distance of others, so that everybody is safe while exercising that right.
Thank you. Now to Lucas from WORT Radio in Madison. Lucas?
Hi, my question is also for Governor Evers. With the current ban on mass gatherings and those protests being scheduled for Friday, it seems like there's been an exemption made on enforcing that ban on First Amendment grounds. How do you weigh that decision against the fact that protesters will likely not be social distancing?
Well, first of all, I don't know if they will or won't. I assume they will. They understand how important I'm sure the protesters understand that it is important to be physically distant so that they can keep not only themselves safe but others. But at the end of the day, it's a law enforcement issue, and I believe law enforcement will handle it appropriately.
Thank you. Now to Howard Hurdy from Wisconsin Watch. Howard?
Hello. Hello, thank you. This is a question for Secretary Palm or Dr. Westergaard. The DHS's initial projections of 440 to 1,500 deaths and 22,000 cases by April 8th are still being used by some people on social media as evidence that the Safer at Home order was an overreaction. What message do you have for people who think that the order goes too far, since Wisconsin is still short of these projections today? Thanks.
So I think that what it proves is that we reacted exactly right, because what a model does, what a projection does, is tell you where you will be without intervention, without an alteration of current behavior. And Safer at Home altered our behavior. It encouraged all of us as Wisconsinites to do what we needed to do to stay safer at home, to flatten the curve, to prevent those deaths and those number of infections. And so, as we have said before, one of the important things about those projections was it told us that we had to work like crazy to prevent them from happening. And that's what we've done the last month, is all work together as hard as we can so that we didn't see that many infections and didn't see that many lost lives. So I think it speaks exactly to the opposite and proves that Safer at Home was an intervention that Wisconsin has done well, and that we certainly know they will continue to do well as we move to turn the dial and start to reengage our economy and our workforce.
Thank you, Howard. Now to Silver Mayan from the UW-Milwaukee. Silver?
Yes, hi, thank you. This is a clarification question for Governor Evers. So we've talked a little bit about the protests, and you've said that most people in Wisconsin are on board with the extension of the Safer at Home order. And as it's been mentioned, some sheriffs, including the Racine County Sheriff, have said they won't enforce the Safer at Home order. But at the same time, there's been kind of a bubbling up against it. There are Republicans who say they want to sue over your powers to set the law and who are calling for Secretary Palm to be fired. And then there's these protests with residents. What do you make of all this pushback beyond simply exercising First Amendment rights? And what's your strategy to respond to these statements, these protests, and these lawsuits? And how do you think it'll ultimately affect what's happening in Wisconsin?
Well, there's a simple question for you. Well, I've been involved with disagreeing with government in the past, and so I get it that people are frustrated, but believe me, the vast, I'll say it one more time, vast majority of the people of Wisconsin understand how important it is to be safer at home, how important it is that we have metrics that we now have, and that we make sure that we get them to a point where we can move on and reopen this economy. This has been an effort by all the people in the state of Wisconsin. I have complete confidence in the people of Wisconsin wanting to have this be over. And the way that it is going to be over is to make sure that they're safer at home, make sure that we have a plan in place that we implement in a great, sound way. We are putting effort behind this to make sure that we get to the point where we have met every one of those metrics and we can start to reopen the state. So that is my response. The people of Wisconsin are understanding of how important this is. They understand how deadly this virus is. They understand how difficult it is if you are susceptible to it, and the process people go through to save their lives and have others save their lives. So I get it. that there's protesters, and I get it that they are concerned, but I am concerned too, and as are the people of Wisconsin. They are doing everything they can to help us solve this problem, and I'm looking forward to the day when we can talk about First Amendment rights about another issue, because it is critically important that we allow people to exercise those rights, but it's also important, even more important, that we continue to save lives.
Thank you. And our last question of the afternoon belongs to Dylan Brogan from Isthmus. Dylan?
Thank you. Thank you. This question is for Dr. Westergaard. What have you learned about the virus that you didn't know a month ago? And is there anything unique about what we're seeing in Wisconsin compared to other regions?
Yeah, thanks. Those are good questions. The second one is a matter of degrees. In the different regions in the country, the epidemic curve looks differently, but I think the virus is behaving fundamentally the same way, meaning that where people are in contact with each other, it's very easily transmissible. I would say the key take-homes that we've learned from the research in the past 2 weeks really are concerning. Bad news, frankly, that the likelihood of transmission early in the course of illness is much greater than we initially feared. So people, one study estimated that as high as 44% of transmissions might occur from people before they show symptoms. So that makes it very challenging to do infection control when people aren't aware that they have an infection but could still be exposing other people who they're in close contact to. So this really makes the stakes really high for our future efforts of really scaling up and intensifying our contact tracing, that when we have a known case, we very intensively, I try to identify people who have been in contact so that so people are in quarantine. That's really the whole principle of quarantining people based on exposure, is that they may be spreading the virus without having symptoms. So I think that the new science about the virus from epidemiologic studies just really reinforces how challenging this is, and sort of really supports where we're putting our efforts into infection control and contact tracing.
Thank you, Dylan. And thank you for joining us for today's briefing. Please continue to monitor the DHS Outbreaks and Investigations and COVID-19 web pages for information, data, and guidance. For topics not related to public health, visit the websites of the Governor, Wisconsin Emergency Management, the Department of Workforce Development, and Wisconsin Economic Development Corporation. Thank you, and have a good afternoon.